low carb, high fat, and cholesterol, should you worry? Hello everyone, this is Dr. Cho. Today we're talking about low carb, high fat diets. These diets cut carbs and increase fat intake. But no, it's not about eating tons of meat. Some of you start this diet and get a blood test, only to find your cholesterol levels are high. Total cholesterol, LDL, triglyceride, all elevated and is worrying. Some people even tell you to stop the diet immediately. This video is for anyone doing low carb, high fat, or just worried about cholesterol. Stick around, it'll be helpful. If you like it, please hit that like and subscribe button. So, what does a high cholesterol level mean? Does it mean you're a high cholesterol patient who needs meds right away? Many doctors follow a formula. If LDL, bad cholesterol, is over 190, they prescribe statins. If you have diabetes, they might prescribe statins even at an LDL of 80. This approach is common, but it's old school medicine focused on suppressing symptoms, not treating the root cause. In reality, this can lead to more health problems down the line. Looking at cholesterol levels alone is meaningless. You need to check other markers, like highly sensitive CRP, which measures inflammation in your blood vessels. I covered this in detail in a previous video, so check it out. No single test can definitively diagnose a disease. For example, an X-ray can confirm a broken bone, but most tests aren't that clear-cut. If an MRI or ultrasound shows a lump, doctors order more precise tests, like blood markers or even a biopsy. Biopsies are invasive, almost like surgery, so they're not done lightly. There's a risk of breaking a tumor's capsule and spreading cancer cells. Similarly, high cholesterol on a blood test doesn't automatically make you a high cholesterol patient. High blood sugar doesn't mean you're diabetic. High blood pressure doesn't mean you have hypertension. And low T3 with high TSH doesn't instantly mean hypothyroidism. These simplistic diagnoses oversimplify the body and cause problems. Prescribing cholesterol meds just to lower numbers is wrong. Many doctors do this, but it's not what they learn in medical school or at conferences. Just because everyone does it doesn't make it right. In some cultures, heavy drinking is normal. Does that make it healthy? Of course not. The same applies here. Just because hospital prescribe statins to lower cholesterol doesn't mean it's the right approach. Take statins, lower cholesterol, and prevent heart attacks or strokes. Sounds sweet, but statistics show it barely prevents anything. If you're on a low-carb, high-fat diet and your cholesterol spikes, here's my first piece of advice. Don't check your cholesterol for the first 6 months. It's not meaningful. Cholesterol is a type of fat, and LDL and HDL are lipoproteins. When hospital tests cholesterol, they're looking at a lipid panel, how fats move through your blood. Low-carb, high-fat diets aim to harness the benefits of fat, like reducing inflammation and improving health. But cholesterol isn't just fat, it's a building block for hormones. It can turn into vitamin D, estrogen, progesterone, testosterone, and stress hormones like cortisol. Without cholesterol, your body can't make these. People on low-carb, high-fat diets often feel energized, vibrant, and younger. Why? Because hormone production ramps up. Compared to a carb-heavy diet, hormone signaling can increase fourfold within 1 to 2 hours after eating. Even if you have insulin resistance, your blood sugar might test normal, but that doesn't mean you're in the clear. A fasting blood sugar of 90 to 100 is like scoring 65 on a test where 100 is perfect. You're barely passing. I get nervous just looking at those numbers, even if you're happy with them. High insulin levels, even with normal blood sugar, can lead to diabetes fast. Low carb, high fat diets improve insulin resistance just by cutting carbs, boosting overall health. Adding more fat amplifies the benefits, especially hormone changes. Better skin, sharper focus, higher energy, and less joint pain. These are all thanks to fat-driven hormone shifts. Your body might be rusty at turning cholesterol into hormones. If you've lived on a carb-heavy diet for years, your ability to use fat for hormone production may be sluggish, like a skill you haven't practiced in ages. Even if you eat a lot of fat on a low-carb, high-fat diet, your body might not convert it efficiently, causing cholesterol to pile up and show high on blood tests. In a past video, we talked about how burning fat can release toxins, leading to tough symptoms. It's similar here. You need to acknowledge past neglect of your body, but still love it and understand what's happening. Don't jump to "this diet isn't for me" or "intermittent fasting doesn't suit me" based on a gut feeling. Cholesterol also turns into vitamin D. Many of you worry about low vitamin D levels from blood tests. Some cultures avoid sunlight, which can contribute, but a lack of cholesterol, the raw material, is another cause. Even with plenty of sunlight, without cholesterol under your skin, your body can't make vitamin D. Insulin resistance worsens this. High insulin clears out fat too quickly, leaving little for hormone or vitamin D production. Low-fat diet or avoiding fat altogether make it worse. Low vitamin D raises risks for cancer, infections, and slow recovery. It's crucial for immunity, brain function, and more, not just bone health. It's called a vitamin because you die without it, just like other essential nutrients. Low vitamin D might mean your body is fighting inflammation or recovering from injury or infection. If you take vitamin D supplements and your levels still don't rise, it's like pouring water into a leaky bucket. Unaddressed inflammation is the problem. Check out my past videos on inflammation for more. To fix it, you need to eat enough fat. Even if you eat fat for vitamin D, your body prioritizes stress hormones like cortisol, which maintain blood pressure and are critical for survival. Stress, especially mental stress, wreaks havoc on your health. It's a common cause for many hospital visits. Always check your stress levels. With low-carb, high-fat diets, you don't need to obsess over exact fat-to-carb ratios. You're not weighing every meal, right? There's no universal ratio. Everyone's different. General guidelines exist, but they might not fit you. Just focus on reducing carbs while increasing fat, and adjust slowly. The goal is a body that doesn't rely on carbs, one that stays energized and calm even when blood sugar drops. It's about low insulin and low inflammation. Over time, skipping breakfast or even lunch might feel effortless. Some think skipping breakfast is a disaster, but it's not about your constitution or dopamine issues. It's about fixing insulin resistance. Low-carb, high-fat diets and intermittent fasting aren't short-term fixes. They're lifelong commitments. Quick, extreme programs are tempting, but real health comes from learning proper habits and applying them daily. The process matters more than the result, and happiness lies in that journey. Avoid hardcore approaches like 20-hour fasts or water-only diets. Enjoy small wins, better skin, feeling refreshed in the morning, fewer headaches, more energy. Let's embrace the joyful life we're meant to live. If this helped, please like, subscribe, and share your story in the comments. See you in the next video.